next section will cover the metabolism of aromatic amino acids. Phenylalanine is the amino acid that we'll start with. Phenylalanine is an essential amino acid. It can't be synthesized by human cells, and so it has to be taken up by the diet. It's important not only because it contributes to protein synthesis, but also because it's a biosynthetic precursor of several things, including the amino acid tyrosine, the neurotransmitters dopamine and the catecholamines, and the pigment melanin. The first step in phenylalanine metabolism is the hydroxylation of the aromatic ring to form tyrosine. And this reaction is catalyzed by an enzyme called phenylalanine hydroxylase. In the process, it oxidizes a cofactor called tetrahydrobiopterin to dihydrobiopterin. And this is shown in schematic form here. Here is phenylalanine. Phenylalanine is oxidized to form tyrosine, and in the process, tetrahydrobiopterin is converted to dihydrobiopterin. Now, dihydrobiopterin needs to be recycled back to tetrahydrobiopterin in order for it to function again. This reaction only takes place in the liver, the kidney, and the pancreas. Therefore, these tissues have to be able to provide tyrosine for the rest of the body if it's not sufficiently found in the diet. Now, there's a defect in this that causes a common genetic disease, as illustrated in the following clinical vignette. The parents of a 15-month-old infant bring her to the pediatrician, concerned that she's developing slowly. She rolls over but has not learned to crawl or walk. She seems hyperactive and has episodes of extreme agitation. She's had at least one seizure. In addition to that, her urine has a peculiar mousy aroma. She was adopted from a foreign country as an infant, and so there's no knowledge of her family history and no prenatal or postnatal testing. Physical exam is essentially normal except for some signs of developmental delay and increased muscle tone. Laboratory testing detects phenylpyruvate and phenylacetate in the urine, and the serum phenylalanine levels are elevated. This patient has a disease called phenylketonuria, or PKU. PKU is an autosomal recessive disorder caused by defective tyrosine synthesis. It's one of the most common genetic disorders in North America with a heterozygous frequency of 1 in 11,000. The most common defect is a mutation in phenylalanine hydroxylase, and usually these mutations have little or no residual activity. There's a second form of this disease that can be caused by defects in dihydrobiopterin synthesis or recycling. For example, a defect in dihydropteridine reductase, which prevents recycling of dihydrobiopterin to tetrahydrobiopterin. This can also cause decreased phenylalanine hydroxylase deficiency, although this is a less common cause of it. Either of these defects cause an accumulation of phenylalanine. Now, because the phenylalanine can't be metabolized to tyrosine, it's converted by alternative metabolic pathways to a bunch of toxic metabolites, including things like phenylpyruvate and phenylacetate. These are particularly toxic to the central nervous system, and they cause tremors and seizures, developmental delay, and mental retardation. Now, the symptoms, unfortunately, may not be apparent until the second year of life, at which point the child may have already lost as many as 50 IQ points. For this reason, every state in the United States has mandatory PKU screening for elevated plasma phenylalanine in the neonatal period. The treatment for this disease consists of a phenylalanine-restricted diet. Patients who are diagnosed at birth and who strictly follow the diet usually have little or no symptoms. This is a challenge, though, because the diet is hard to follow. If the disease is diagnosed late, however, following the diet can't reverse any damage that's already been done. It can prevent progressive damage, but it won't reverse any of the damage that's already occurred. Tyrosine produced either by metabolism of phenylalanine or in the diet can be converted to other things as well. The first thing that happens to tyrosine is it's converted to a compound called L-DOPA, and this is basically tyrosine with an additional hydroxy group on the aromatic ring. There are two different enzyme systems which are responsible for this conversion. In melanocytes, the enzyme requires copper as a cofactor, and then the L-DOPA is converted to melanin, which is the pigment which is found in skin. In the adrenal glands and in the central nervous system, L-DOPA formation requires tetrahydrobiopterin, similar to phenylalanine hydroxylase, and it's converted to the neurotransmitters dopamine, epinephrine, and norepinephrine. Tyrosine can also be metabolized to fumarate and acetoacetate, and for this reason, the fumarate can go into the citric acid cycle and form gluconeogenic intermediates. So it's a gluconeogenic amino acid. The acetoacetate obviously is a ketone body. And so tyrosine is an example of one of the 4 amino acids that is both ketogenic and gluconeogenic. So here's the whole picture. Phenylalanine is converted to tyrosine. Tyrosine is converted to L-DOPA. L-DOPA is converted to melanin, or in the skin and in the adrenal gland and the central nervous system, it's converted to dopamine, then to norepinephrine, then to epinephrine. And then this alternative pathway, tyrosine can be degraded to fumarate and acetoacetate. Now there are several defects in these pathways. One of these is alkaptonuria. Alkaptonuria is a defect in the degradation of tyrosine to the fumarate and acetoacetate. Part of this process requires that tyrosine be oxidized into 4-hydroxyphenylpyruvate and then into homogentisate. Homogentisate is then broken down by further oxidation. If there's a deficiency of the enzyme which oxidizes homogentisate, that causes alkaptonuria. The hallmark of alkaptonuria is urine that looks normal initially but turns dark on standing for a few hours. The patients also get arthritis from pigmented joint deposits, and that dark color comes from polymerized homogentisate. So you can treat this disease by giving a restriction of dietary protein, giving them a low-protein diet, especially a protein which is deficient in phenylalanine and tyrosine. Another example of how these pathways can be defective is in albinism. Classical albinism is caused by a mutation in tyrosinase, which is the first enzyme in the melanin synthesis pathway. Patients with this defect are unable to make skin pigment, and so they are very white, and they're susceptible to sunburn and skin cancer because they don't have the melanin which protects them from UV radiation. So that's our discussion of phenylalanine and tyrosine. Another of the aromatic amino acids is the amino acid tryptophan. Tryptophan is like phenylalanine and is an essential amino acid. It cannot be synthesized, but has to be obtained from the diet. Now, tryptophan is important because it's also a biosynthetic precursor for serotonin, for melatonin, and for nicotinamide. Serotonin is called 5-hydroxytryptamine, or 5-HT. It's a neurotransmitter. It's found in the central nervous system. It's a very important regulator of lots of physiologic processes, including sleep and appetite, and mood, for example. Its conversion from tryptophan includes hydroxylation of the aromatic ring. This requires tetrahydrobiopterin as cofactor, and then decarboxylation of the carbon skeleton, as shown here. So here's tryptophan, here's the hydroxylation, and here's its eventual conversion to serotonin, or 5-hydroxytryptamine. This is the decarboxylation. Now, many of the neurotransmitters, including epinephrine, norepinephrine, and serotonin, are degraded by an enzyme that's called monoamine oxidase. So monoamine oxidase deaminates this, and then it can be further chemically modified and excreted in the urine. Monoamine oxidase uses oxygen to deaminate the neurotransmitters, as I indicated. This produces an aldehyde and hydrogen peroxide. Now, there are certain antidepressants that have been used in the past called MAO inhibitors, and these increase the concentration of neurotransmitters by blocking their degradation. Now, one of the other hormones that's produced by tryptophan is melatonin. Melatonin is a hormone that's produced by the pineal gland, and it helps to regulate circadian rhythms in the body. And the way this works is it's converted from serotonin. Basically, what happens to serotonin is it gets acetylated by an enzyme which only works in the dark. It's inhibited, actually, by exposure to the light. And so the acetylation of serotonin to form melatonin only occurs in the dark. Then there's an additional methylation of the 5-hydroxy group on the aromatic ring to form melatonin. Now, it's not important that you remember the details of this. Just remember that melatonin comes from serotonin, and it's synthesized in a dark-dependent fashion. Now, how is tryptophan degraded? Tryptophan is degraded to formate, to alanine, and to 2-acetyl-CoA molecules. So in this way, tryptophan is also a gluconeogenic as well as ketogenic amino acid. During this process, 3% of the degradation products are spontaneously converted to a precursor of the vitamin niacin called nicotinamide. And this pathway is important because dietary niacin is typically inadequate to meet the body's needs. And so you have this tryptophan, which produces formate and alanine, and then acetyl-CoA. Okay, some of these are converted by this alternative pathway to nicotinate mononucleotide. Okay? And this nicotinate mononucleotide then can be converted to NAD+, nicotinamide adenine nucleotide. And this is how we produce the NAD that we need in our cells. So here's a clinical vignette that deals with this metabolic pathway. A woman brings her 70-year-old father to his primary care physician. She's concerned because he's recently developed a rash and diarrhea. In addition, she states that he's been very depressed. His wife died a year ago, leaving him to care for himself, and the daughter reports that he's hardly eating at all. Physical exam shows a thin, undernourished elderly man who has a generalized rash and glossitis, which is a red, swollen tongue. Lab tests show he has a significant aminoaciduria. This patient has a disease called Hartnep's disease. And in this particular setting, the Hartnep's disease is causing pellagra, which is the word we use for niacin deficiency. Hartnep's disease is an autosomal recessive trait. It has an incidence of about 1 in 30,000 newborns. However, only 10% of the individuals ever develop clinical signs or symptoms. And these signs or symptoms usually develop under conditions of poor nutrition, illness, or stress. The disease is caused by a defect in the reabsorption of amino acids in the kidney, causing many of the amino acids to be excreted in the urine. This is particularly a problem for tryptophan because it's an essential amino acid 1, and also because it occurs in relatively low abundance. The loss of tryptophan causes a secondary deficiency of niacin, which is produced from the tryptophan degradation. This causes the symptoms of pellagra, niacin deficiency, which include depression, diarrhea, dermatitis, and glossitis. Some of the patients also exhibit neurologic signs, including cerebellar ataxia. So here's a summary of the aromatic amino acids. Phenylalanine is important not only in protein synthesis, but also because it serves as a precursor for tyrosine, dopamine, catecholamines, and melanin. The deficiency of phenylalanine hydroxylase causes phenylketonuria, or PKU, and phenylalanine is both a gluconeogenic as well as a ketogenic amino acid. Tryptophan is converted to serotonin, to melatonin, and to nicotinate. Deficiency of tryptophan can be caused by Hartnep's disease, which leads to a hereditary pellagra-like syndrome. And tryptophan is also both gluconeogenic and ketogenic. And this concludes the section on aromatic amino